My name is Leah LeMay, and this TED Talk is for leadership practices and organizational communications. The discussion today will be on the importance of patient education in healthcare and the strategies you can follow to provide effective patient education to avoid hospital readmissions. You may be wondering why this topic is so important and what impact it has on the healthcare industry. To start, our patients become dissatisfied with the healthcare industry when they find themselves declining physically and become readmitted to the hospital. Not being able to understand their disease or how to properly manage their health is frustrating and stressful for the patient and their family. Readmissions are a cost burden not only for the patient, but on Medicare, state Medicaid, and private insurance companies. Patient readmissions also cause pressure and increased costs on the hospitals. An article published in the Annual Review of Medicine in 2014 titled Reducing Hospital Readmission, Current Strategies and Future Directions, written by Dr. Kripalani and Associates, states that reducing readmissions has become a mandate for hospitals across the United States due to implementation of public reporting and financial penalties for readmissions. These new financial penalties for facilities with high readmission rates have intensified efforts to reduce rehospitalization. The article also states that among Medicare beneficiaries discharged to a post-acute care facility in 2006, nearly 25% of these patients were readmitted within 30 days at a cost of $4.34 billion. The rate of readmissions from post-acute care facilities has since increased by as much as 30% since 2000, and is continuing to rise, especially in some chronic conditions, such as congestive heart failure. According to the Centers for Medicare and Medicaid Services, at least 20% of all patients who are admitted to a hospital will be readmitted within 30 days of being discharged, but 75% of these readmissions could have been prevented with better care and education. Many facilities state that they educate patients and provide discharge paperwork with educational text for the patients to review. However, the readmission rate is still increasing, so how can we improve patient education? The focus of this talk is how improvements in patient education can help in preventing hospital readmissions. We can agree that well-educated patients are able to understand and are better at managing their own health and medical care. The problem is that many patients do not receive sufficient education on how to manage their care, about the disease process, how to take their medications, or whom to follow up with after discharge. Many patients also report that they are confused, overwhelmed, and don't understand the discharge instructions. As a visiting nurse, I have personally experienced that many patients are discharged from facilities with detailed, lengthy discharge instructions, but many do not actually read the education material sent home or understand it. I sometimes find the discharge paperwork thrown in piles on their kitchen tables or in the trash can. In some instances, when providing education, I hear from the patient comments such as, "No one has ever told me that before," and "Oh, that makes sense now," and "I didn't know I was supposed to do that." And sometimes this information was actually provided to them, but they needed to hear it again or in a different format to understand. Providing patient education sounds simple, but it is actually a difficult task that a healthcare clinician needs to be skilled in. It is up to the nurse to assess and evaluate the patient's learning needs and readiness to learn because everyone learns differently. There are many barriers when educating patients, such as the education medium, patient's language, literacy levels, cultural competence, current distractions, and the patient's current environment. Another big reason that patients are not getting the proper discharge education is that many facilities are short-staffed, and nurses and clinicians are unable to find the time to properly take to assess the patient's understanding and provide education. It's difficult for nurses to manage and create time for education with our heavy task assignment, but it is important to prevent patients from hospital readmission or a decline in health. I always hear other nurses that the patient is not going to listen anyway, so why bother? This behavior observed could be easily changed if the nurse had a skill and understanding on how to provide effective education. So how do we do that? First, the environment plays a large factor in patients' retention to discharge instructions and education. I know when I am a patient myself, I find it difficult to pay attention to the staff in a clinical setting when I am feeling sick, stressed, or even hopeless. Most patients only hear the first few sentences and then start analyzing the information, get emotional, or are distracted by the busy environment and can even shut down. Sometimes the information is better understood at a later time with less distractions and stress. A patient can be so overwhelmed that they can't interpret the information being taught. Sometimes it is best to provide education in multiple sessions if there is a lot of information to be covered and retained. Recognizing and assessing environmental factors are required before a nurse starts education or instructions. For example, my dad was recently admitted to the hospital. When the nurse came in to provide discharge education, my dad was paying attention to the news and trying to rush the nurse out of the room so he could watch the television instead, even though he was pretending to give the nurse his full attention. It is important that there are no distractions when a patient is being provided discharge information. I turned the television off so my dad could give his full attention to the nurse without other stimulation distracting him. Second, it is important to analyze a patient's literacy, culture, and language to determine how the patient will absorb the information and understand it. Many patients are provided lengthy educational handouts from the hospital in which they say they read, but we can all agree that it wasn't fully read. I find out later through assessment that the patient can't actually read, but will not admit to it due to embarrassment of illiteracy. A nurse can find out the patient's level of literacy by asking the patient to read their medication labels to them or their discharge instructions. It is also important to determine the reading level of the patient because they may be able to read but can't interpret the medical jargon. Medical language is already difficult as it is, and many patients do not understand the terms used. Another cultural problem with written education is that the language of the material is always in English. Majority of educational handouts are written in English, and sometimes in limited situations can be a Spanish version. This poses a problem. 40% of my current patient population are Middle Eastern. I have more Middle Eastern patients than I do Hispanic right now. Majority of them do not speak or read English, and they have chronic diseases that are difficult to manage and control due to lack of patient adherence and understanding of the disease. I want to provide educational pamphlets and charts, but my agency only provides them in English or Spanish. Even with a family member translating or the use of a translation line, the patient is not able to understand the material because some people are visual and need to read the text themselves to process and comprehend. In America, we have many immigrants whose primary language is not English or even Spanish. They may be able to speak it, but they may not be able to read it. I had a patient who spoke English fluently, but he could not read the nutrition labels on food to make healthier and wiser food choices for his disease. Having education provided in a patient's primary language is important for the patient to understand and manage their condition. The medium that the education is presented in is also an important consideration. A nurse needs to understand how the patient learns best and to tailor the education to the patient's advantage. For example, one patient may learn best from visuals or reading printed instructions. Another may prefer to watch a demonstration. According to a journal article by Deborah Polster in Nursing Management, blending elements from multiple adult learning styles increases the likelihood that patients will remember essential information. Majority of people are visual learners and prefer to have a demonstration or visual aid to enhance understanding. Many elderly patients also have trouble with vision and have difficulty reading these educational handouts because the print is so fine. So presentations such as large font and layout are important to consider with the elderly population. Find out if your patient learns best by watching a DVD or presentation. Sometimes even a hands-on approach by which the patient gets to perform a procedure with your guidance is usually the best method in retaining the education, such as wound care. As a nurse, I only learned by actively doing a procedure hands-on myself. I had to watch an ostomy change, and even though I watched it twice, read the step-by-step instructions, and was taught about it and educated by another nurse, I still didn't feel confident or understand it. It wasn't until I held the supplies and attempted it myself and was able to touch and feel, I was finally able to comprehend and start to memorize the steps. Another example is having the patient participate in managing their care by documenting and recording their health. Telehealth is a way to monitor a patient's health status remotely by having the patient take their weight, blood pressure, pulse ox, and even heart rate every day. These machines will get installed and the patient will routinely comply to using the device and tracking their vitals. These machines are especially helpful in patients with chronic heart failure to monitor status and changes. However, when the patient is healthy enough for discharge and the machines get pulled from the home, the patient becomes readmitted for acute heart failure. Why is this? The patient wasn't understanding the importance of why they were taking these vitals every day. They just thought they had to and routinely did it every day until they didn't have the equipment anymore. They also assumed that since they were discharged from services, that they are now healthy and don't need to track their vitals. Reviewing the vitals and importance of them during the telehealth monitoring helps the patient understand why they need to continue to keep track of their status and recognize patterns to avoid readmission. A patient can be able to report their signs or symptoms to their physician if they can recognize and understand them, such as a 3-pound weight gain in one day and increased shortness of breath indicates acute heart failure, and they could problem solve on their own by changing their diet or calling their physician to get a prescription for an extra diuretic rather than being readmitted. Having the patient participate in their care and understand how to recognize a decline and how to self-manage it prevents patients from being readmitted. It is important to quiz your patients and have them teach back to make sure that they actually retain the information provided. Many patients will say that they know the answer when asked a question, but do they really? For example, don't ask a patient if they know the signs or symptoms of infection to monitor. You will get a simple response like yes or no. Rather, ask them to tell you the signs and symptoms themselves and see what they retained and follow up each visit with reviewing the educational material and quizzing their retention of the knowledge. Ask the patient to explain the material you've just taught or taught previously at other encounters. Based on their response, you can determine how much and how well they comprehend and recall. If the patient has trouble explaining or recalling the material, you'll need to repeat, clarify, or modify the way it is taught so that they can retain it. They might need to repeat this cycle several times because sometimes it is better understood the third time. When educating your patients, it is important to keep educational barriers in mind. Patients may not even be aware that they do not understand what is being taught to them, so it is important to assess your patient's understanding. Providing proper education to patients is one of the most important elements in helping patients manage their own health and preventing hospital readmissions. To manage their health effectively, they must understand their health condition, its signs and symptoms, rationales for treatments, medication side effects, and when to seek help from healthcare professionals. Effective self-management increases patients' confidence in their own health management, especially in performing specific tasks, such as monitoring symptoms, watching their diet, adjusting medications based on specific criteria, incorporating exercise into daily routine, and knowing when to seek medical advice. I hope this discussion helped raise awareness on the importance of patient education, and I hope the strategies provided will be useful in your career to provide quality patient care. Have a wonderful day.